This month is Pancreatic Cancer Awareness Month, and the staff at St. Joseph's Cancer Institute wants you to know that you can always turn to them. We met one patient who recently did and is now racing towards the finish line in his treatment. Take a look. This time.
Special.
As a mechanic and a race car driver, Dale Jackson knows what the excitement of a finish line feels like. But this one is something special.
Love you.
Love you too. I'm finished up and rang the bell and put my fingerprint on everything and hugged everybody and thanked them, and they took good care of me.
Not even a full year ago, Dale experienced severe stomach pain, so much so that he couldn't even eat. He was referred to a couple of hospitals in the Pennsylvania area until ultimately coming to St. Joseph's Cancer Institute, where doctors discovered he had pancreatic cancer.
Got right on it. I mean, it took a couple months because they had to go through the whole process again of, checking me out, but cancer never showed up in my blood, so they were like, you don't have cancer. Well, then finally they decided to do a biopsy. And when they did, that's when they found it.
Dr. Richard Schrader says in the U.S. there are only about 56,000 new cases of pancreatic cancer diagnosed each year, as opposed to roughly 200,000 for breast cancer, prostate, and lung cancers each. Yet, pancreatic cancer is known as being very aggressive, the fourth most fatal cancer, according to doctors.
So I think one of the challenges with pancreatic cancer is that the symptoms can be very vague. So it can be changes in the liver function test that an internist noticed. The patient can notice that their skin is yellow, that they're jaundiced, or their urine is dark. Sometimes it's non-specific symptoms, even back pain, abdominal pain, nausea, bloating, losing weight.
And fighting the cancer requires a collaborative approach, not just between the patients and the doctors, but the doctors themselves.
I think in a community setting, to have two hepatobiliary surgeons, the ability to have a GI physician who does a special procedure to diagnose and biopsy the cancer, as well as the medical oncologist, radiation oncologist, all together one team, have a multidisciplinary approach, I think is pretty unique in a community setting to be able to offer that to patients. When it's appropriate, we do have an excellent palliative care team that we work with. We have palliative care physicians, and then as patients are going through their treatments and when they finish their treatments, we have the Wellness and Survivorship Center where we sort of help patients with mind and body. So there's healing touch, and there's massage therapy and acupuncture and yoga and different activities that really help with stress.
And the core members of that team of doctors have all been there, working with each other to help patients for more than a decade.
I feel healthy. Gained 25 pounds back since, I was 205 pounds and dropped all the way down to about 150 pounds. Sometimes
the cancer can involve certain blood vessels that can make surgery very difficult or even impossible. And he fit into that category where he was borderline resectable, meaning it wasn't clear that the cancer had spread elsewhere or that he couldn't ultimately undergo surgery, but to do so would be very helpful to shrink down the tumor.
Dale had chemo first, and with the ringing of the bell, is now done with radiation, meaning doctors can soon schedule him for surgery and get that shrunken tumor out.
As soon as you start feeling something wrong, definitely come. St. Joseph's, they're the ones who's going to take care of you, Just I want to thank all the staff and nurses, and especially Gina.
Really tough period. Yeah, you're almost there. He knows the staff at St. Joseph's Cancer Institute is not only helping him finish the race, but cheering him along on his very tough road. For more information on St. Joseph's Cancer Institute, visit umms.org/cancer. We'll be right back with more Midday Maryland right after this. Stay tuned.